Hi, this is the second episode of our new series called Lessons Learned for Endometriosis. The lesson that I'm going to share with you today is the one that says that make sure your gynecologist, your endometriosis specialist, checks the MRI images himself or herself. I will share a case with a patient's consent of a 30-year-old patient, nulliparous, troubled with pelvic pain that underwent what she describes as a laparoscopic cystectomy by a colleague last year of apparently a 10 centimeter endometrioma. I do not have any copies of the surgery. However, the patient said that he was always being troubled by severe pain inside the bowel. Now, this is a colorectal or GI symptoms are frequent in patients with endometriosis, and the majority of them do not have colorectal endometriosis. However, the pain that is described by the patient inside the bowel is, in my opinion, very common symptom with patients that really have colorectal endometriosis. So she underwent, because of the severity of her symptoms, she underwent a pelvic MRI with the appropriate protocol. The radiologist reported, made a vague comment about some collection behind the cervix, possibly suggestive of deep endometriosis. There was actually no mentioning of bowel endometriosis. It is very interesting because the patient came to me for a second opinion, saying that she thinks that she has bowel endometriosis thanks to GPT, ChatGPT. It is really impressive that in this case ChatGPT did better than humans. So as I always do in those cases, I ask the patient to bring me the MRI, the CD of her MRI, and we review together. And what we saw is the image that follows here. So what one can see here is a very clear evidence of infiltration of the posterior vaginal fold and retrocervical area by endometriosis with the red arrows, and then with the yellow arrows you can see a really large deep nodule of deep endometriosis of the rectum. So we really saw that the results of that MRI were largely different from what was actually reported, which means that had a specialist not seen the MRI images themselves or done a appropriate specialist transvaginal or transrectal scan, depending on the experience and the appropriateness of the examination and the wish of the patient, that diagnosis could have been completely missed, having of course significant impacts on the further care of the patient. Of course, the method of surgically approaching these complex cases is not the topic of this video, but hopefully the message that came across here is do not just rely on the MRI report. Make sure you see the images of the MRI, review the CD of the MRI with a specialist in the disease in order to get an appropriate diagnosis and in order to make an appropriate plan of further care. Thank you.